Welcome to Ajat Bioacademy. Today's lecture topic is drug allergy, or you can say drug hypersensitivity reaction. In my last lecture, I discussed the detailed mechanism of allergy, but today I will talk about drug allergy types basically. So, drug allergy. That means here drug is considered as a allergen, okay, and drug induced allergy, that is drug allergy, and drug allergy are also drug hypersensitivity reaction. So already drug allergy is basically classified as four types. One is type 1, type 2, type 3 and type 4. Okay, so one after another I will discuss. So come to the point. Type 1. Type 1, its another name is immediate hypersensitivity reaction or immediate allergic reaction, or you can say IgE mediated allergic problem or hypersensitivity reaction. Also you can say anaphylactic reaction. Okay, so this is the mainstream drug allergy. You can say the allergy term is mostly appropriate with the type 1. Both all these are hypersensitivity reaction. This one also hypersensitivity reaction, but all hypersensitivity reaction cannot be allergic. So allergy means basically you can consider as a allergy, that is type 1 allergy. Why it is called type 1 allergy? Already in my last lecture, when I explained the mechanism of allergy, then I mentioned over there that is IgE. So IgE, one of the major antibody which is responsible for causing allergy. Okay, how? You can watch my previous video. Okay, so I will just briefly I will briefly discuss uh, without writing. Okay, so like when allergen, that means drug, will enter in your body, your antigen presenting cell or macrophage basically will try to engulf it or try to degrade it. When it will fail, then what will happen? T cell will be activated by the antigen presenting cell, that is macrophage, and then when T cell will be activated, then basically helper T cell, and then it will secrete cytokine, and then cytokine basically IL interleukin 4 or interleukin 13, and that IL interleukin, that is cytokine, will activate the B cell. And what will happen when B cell will be activated? It will produce antibody, and that antibody, that can be IgG, IgM, IgE, like that. And here there is IgE mediated, so you can consider that is IgE. So that IgE will produce from the B cell, and then IgE antibody will just bind with the surface of the mast cell, because mast cell surface has a antibody binding receptor protein. Okay, so when mast cell will be activated, then mast cell will produce or secrete histamine. That is the one of the mediator of that immunological reaction. When histamine will release, then histamine bind with the surface of the blood vessel H1 receptor. Okay, and it will cause vasodilation. When vasodilation occur, then your other blood component will come out into the affected area and it will make it swell. That is swelling occur. When RBC will come, it will look like rash, that is redness, and when the area will be activated, the affected, then over there present nerve ending will be highly stimulated. Then you will feel sensation, you will feel itching, and over there also will produce some local mediators, that is prostaglandin or leukotriene, like that, and that will make activate the pain receptor or local actually inhibit the impulse of the nerve, so it will cause pain. So that will happen after vasodilation, so you can say that is the allergy. Okay, so the overall signaling overall events is called the basic allergy. So in that way you can say consider I type 1 hypersensitivity reaction is basically the drug allergy. Okay, and here penicillin is one of the major drug to cause allergy. Also insulin can cause allergy, at the site of injection, that is in subcutaneous. When we will inject, the injected area uh, can be inflamed by causing allergic reaction, and also aspirin can cause type 1 hypersensitivity reaction, immediate, or you can say IgE mediated. And then come to the point of type 2. So type 2 is basically caused, another name is cytotoxic hypersensitivity reaction. You can say antibody dependent hypersensitivity reaction. And why it is called? This is the one of the major thing. So what will happen when drug will enter in your body? The drug will bind with specific some cell surface of the protein cell surface. That means drug will bind with the protein which is present on the surface of the cell. Then what will happen? The drug is antigen, allergen. It will bind with the surface of the cell, and the cellular structure will change. And what will happen? Antibody will go there, and antibody degrade the cell. Okay, so the antibody will cause the toxicity of a particular against a particular cell which is modified by the drug. Okay, so you can say cytotoxic hypersensitivity, because your cell will damage by antibody. How? The cell will be modified by the drug, that is antigen. Okay, so you can say cytotoxic, and this is called antibody dependent, because this reaction is dependent on antibody. What type of antibody? This is IgG and IgM. IgG and IgM. IgG can show toxicity, or IgM can also show toxicity. Okay, so just simply you can think, you can take a drug and it will bind on the surface of the cell, cell surface binding protein like that. Okay, and it will cause deformation, and your antibody will go there and destroy it. Okay, so like that. So quinidine, the anti-malarial drug, or methyl dopa antihypertensive drug, that drug can show the hypersensitivity reaction like type 2. Okay, and then come to the type 3. Type 3, another name is immunocomplex hypersensitivity reaction. You can also say antigen antibody complex hypersensitivity reaction. And how it will happen? By the name of this immunocomplex or antigen antibody complex. Antigen antibody always show the opposite reaction, that is both are each other. Antigen antibody are enemy. Okay, so what will happen when you will take drug? That drug is allergen and that drug is antigen. Okay, and your body immune system will produce antibody, and that antibody will make a complex with that antigen. That means drug will bind with the antibody, and antibody drug or antigen antibody complex will form a complex, and that complex will just circulate through the bloodstream. Okay, and you will just move, and it will trap in a very tiny blood capillaries, and then blood capillaries is located within the cell tissues, and that means finally the antigen antibody complex will deposited on the cell tissues, and over there it will show the activity toxicity or hypersensitivity reaction. So this is called immunocomplex. That means antigen antibody complex. Here antigen means drug, and antibody, the antibody. So mostly IgG and IgM, as like type 2, are responsible, but here mostly responsible is IgG, and the mechanism is different. Mechanism that antibody will make a complex directly with the drug, that is antigen. Here it is the mechanism. So this is type 2. So this is called antigen antibody complex hypersensitivity reaction. And here the drug is sulfonamide, the sulfur drug, that is antibiotic, and also hydralazine, this is the vasodilator. So this is the type 3 hypersensitivity reaction. And last one is type 4. And type 4, you can also say the delayed hypersensitivity reaction. Also you can say the cell mediated hypersensitivity reaction. Also you can say T cell mediated hypersensitivity reaction, and this hypersensitivity reaction is basically happening within within the skin. Okay, so what will happen here? The drug will be deposited on the tissues or skin tissues, basically skin. Then what will happen over there? That drug will be identified by the T cell, basically helper T cell, and then helper T cell will arrange a immunological reaction. So this is called cell mediated, because when drug will be trapped into the skin, then your T cell will find out the affected area, and it will call upon the immunological further reaction. So this is the delayed hypersensitivity reaction and cell mediated or T cell mediated. But question is that why it is called delayed? You know, the immediate is very few minutes to few hours to few days, and this is basically 3 days or 7 days. But this is happening after exposure only 72 hours. But why it is called delayed? Because it's compared with the actual allergic reaction, that is type 1. So it is just happening within few seconds to few minutes or hour, and it will happen within 72 hours. So in comparison with the type 1, it is delayed, but actually it is not delayed with other. That is, it will take 2 to 3 days even. Okay, so this is the delayed one. So overall, these are type of hypersensitivity reaction. So this is these all are hypersensitivity reaction. But when you will just use allergy, the terminology, it will be more appropriate with the type 1 hypersensitivity reaction. And type 2, type 3, type 4, these are basically considered as a hypersensitivity reaction. You can also say these are the allergic drug allergy, no problem, but mostly appropriate is hypersensitivity other than drug allergy, because the ideal allergic character will be just connected basically with the type 1 hypersensitivity reaction. So this is the type of allergy, drug allergy, and these are the example. So here abacavir, basically the antiviral drug, you know, the phenytoin, that is anti-epileptic drug, and allopurinol, this drug is basically used for gout. Okay, so this is all about drug allergy. Thank you very much.